So we're going to be demonstrating Marma points as part of Ayurvedic medicine. There are energy points on the face, and there's a couple of ways you can do this. You can either do the points, or you could do a massage, incorporate this in any other treatment that you'd like to do, but this is the pattern that we're going to follow. We're going to use these 3 fingers, and if you want to remember how to do it, you can number the fingers 1, 2, and 3. We're going to take the energy and we're going to walk it off the face up to the crown chakra. We're going to start on the Marma point that's on the chin with finger number 3, overlapping. Reach back with finger number 2. When you go from point to point, leave the pressure on, make contact with the next point, take the pressure off, bring your fingers around, and then press down. Lift up, make contact, release, and press down. Lift up, make contact, release, press down. Lift up, make contact, release. Under the eyes, you don't want to use a lot of pressure, and you notice how I laid my fingers down. If you see darkness under the eyes or puffiness, you could do some little pumping motions there like this. Now you're going to have to swing your hand around because you're going to go from this position to the use of your 3rd finger at the corner of the eye. So you lift up, reach back, make contact, release, swing your hand, and then make pressure. Release, contact, pressure. Lift up, contact, pressure. Then we're going to use our thumbs on the Marmas on the forehead. Right hand is on the face, left hand is on top. Switch, go to the next Marma. Switch and take your left hand off. Then sweep the energy off the face. Now we're going to walk through the meridians, show you 20 important points that we learn in class and how to access them. And we'll start running them according to the nutrient cycle. We'll start at the beginning of the day. The first meridian is the lung meridian. It's from 3 a.m. to 5 a.m. Lung is an organ that works all the time, which means it's yin. The direction of the energy is coming up from the ground, from the earth. So the lung starts here. It's in the little dip between the pec major and the deltoid. And it's going to run the arm to the thumb. When you're doing energy work, Eastern work, an anatomical position is with the person standing, facing forward, and with their arms above their head on either side with their palms facing forward. So energy has to travel from the feet all the way up to the hand. It's going to take 2 meridians to complete that circuit. So whenever you do the nutrient cycle, you're going to have 2 yin meridians that come up from the feet to the body and from the body to the hand. Then we're going to have yang meridians that are going to come down from the sky, from the earth to the earth, and they're going to start on the hand, go to the face, from the face to the feet. So you see that was 2 yins and 2 yangs. That completes 1 circuit. There are 3 of them, and they make a nutrient cycle, which encompasses 24 hours of one day. That's why we call it a Chinese clock, because they're mapping out the 12 meridians. Energy is in each one for 2 hours, so it's a 24-hour cycle. So long as the first one, from 3 a.m. to 5 a.m. They're paired according to the elements. And the metal element, lung, is paired with the large intestine. That's going to be coming down, that's going to be posterior. So from the posterior side of the index finger, your large intestine meridian is going to come down the back of the arm, around to the face, and up to the side of the nose. So that was the metal element, the yin and the yang. I have to go from the face to the feet. So now I'm going to go to the earth element, and that was a yang, so I have to have another yang. It's going to be stomach. Stomach starts in the eyes, goes around the eye, down, out, through the nipple. At the hip, it comes out a little more anterolateral. So as you go down the leg, it's right to the outside of the kneecap. Down the leg and off the second toe. In the earth element paired with the stomach is the spleen. And the spleen is going to start on the outside edge of the big toenail, up the midline of the body. When it gets to the chest, it's going to come out to the armpit and back down to the bottom of the rib cage. So that was the earth element. Now we're going to go to the what we call primary fire. That was a yin, so I'm going to go to the primary yin fire element, which is heart. Heart starts under the armpit and goes to the little finger. What's paired with the heart is the small intestine, which is the posterior side of your little finger. That's going to come down the back of the arm, up across the face, and to the tragus of the ear. So that was the primary fire element. Now we're going to go to the water element. That was a yang, so we're going to start with the yang, which is the bladder. The bladder starts here on the medial edge of the eyebrow. It's the only meridian that's on the back of the body. It's going to go over the head, down to the spine, and on either side of the spine it's going to split. So now you have 4 channels. They come all the way down the back of the body, all the way down the back of the legs, and off the little toe. Paired with the bladder in the water element is the kidney. It starts on the bottom of the foot. Kidney 1 is in the solar plexus of the foot, the most medial one. It's going to run up the inside of the leg, on either side of your navel, up to the end of your clavicle. So that's your water element. You ended with a kidney. We're going to go back to the fire, do the secondary fire, which is the pericardium. The pericardium is just lateral to the nipple. It's going to run up the arm, right down the middle to the tall finger. Paired with the pericardium is the triple warmer. That's going to come from your ring finger, back up the back side of the arm, up around the face, and to the edge of the eye, what we call the canthus of the eye. So that's your secondary fire. Now we're going to go to the wood. We're going to start at the outside edge of the eyebrow for the gallbladder. It goes back behind the ear, back up to the edge of the hairline, back around the back, behind the shoulder, in front of the shoulder, comes around like this and goes down. Off to the side, it's the most lateral one, and it's going to go straight down the outside of the body, all the way down to the 4th toe, It's paired with the liver and that wood element. The liver is on the inside edge of the big toenail, goes up the foot, it's in the medial side of the leg, comes to the bottom of the rib cage and hooks in along that 12th rib. Then we start the cycle back over. So we would go back to the long. Okay, so once we learn where our meridians are, we're going to learn a couple of points that go on those meridians. Standard points, most experts say there's 365. We're only going to look at 20 of them, which seem to be doing a really good job of balancing the body. You can always learn the rest of them, but we're going to be using digital pressure for them. We're not needling. It's not acupuncture, it's acupressure, but it is very effective. We're going to start with a point right here. And almost all of us, whenever we have a tension headache or our eyes are tired, we just pinch right there because it relieves it. That's a special point number 1. Special point number 2 is right on the temple. We rub that when we have headaches and when we're tired because it helps. That's special point number 2. On either side of the nostril, at the end of the large intestine meridian, you have point number 20. It's called welcome fragrance. So if you ever have clogged sinuses, if you press this point, it'll help relieve that. That's large intestine 20. Now, I'm going to show you on the back of his head. I'm going to turn his head. And right here at the base of the occiput, on either side of that ligamentum nuchae, you have a point for the gallbladder. It's point number 20. It's a really good point. It helps relax all the fascia and all the muscle tissue that comes up, and for any kind of tension headache. Then we're going to go to the trigger point for the upper trap, and that's going to be gallbladder 21. Usually you can find it easy because almost everybody has a little adhesion there. But another way you can always find it is you're going to use these 2 fingers. You're going to put one at the neck and one at the end of the shoulder on the acromion, and where your index finger goes straight down is for almost everyone, that's where that point is. So that's gallbladder 21. If you bring the arm out to about 90 degrees, at the top, where the deltoid muscle meets the shoulder, there's usually a little indentation there because you have a groove in the humerus for the biceps tendon to pass through. Find that point, find that tendon, that's large intestine 15, right there. Now if you bend the elbow up, you'll see how the muscle tissue makes a fold, and where it comes down from that crease is another great point for the arm, and that's large intestine 11. Now, 4 fingers is what we call 3 soon. This is a measurement that we use to find points. A soon is just an osteo inch. But if I come up from that crease on the wrist to right there in the midline, that's triple warmer 5. Triple warmer 5. Great for wrist pain, congestion, feeling a little tired. On that same point, but on the anterior side of the arm, is pericardium 6. This one is a well-known point for any kind of motion sickness. A really good point right there for that. If you make a fist, you'll see there's a little apex to the crease on the outside edge of the hand, right below the little finger. That is small intestine 3. Tired hands, stiff fingers, that's a really good point to work right there, small intestine 3. Now the one that has a very special name, and everyone should know how to work this point, but it is not something you would want to work on any pregnant woman. But this is the large intestine meridian, and if you're right there in that V between the 2 metacarpals, against this bone, is large intestine 4. It's called Hoku point, and that just means it's good for everything. The lung meridian is coming along the edge of the hand, and it makes a little zigzag back, a little more posterior. If you feel along the radial bone, you'll feel a point at the end, the styloid process. And if you come just a little proximal to it, a little above it, you're going to feel a little dip in that bone, and that's lung 7. That's for weakness in the wrist and the hand, lung 7. If you come down along the side of the body and up on the hip, between the sacrum and the edge of the hip, if you make 3 divisions, that first third of the hip is going to be gallbladder 30. Great point for hip problems, any kind of stiffness or soreness, gallbladder 30. Coming down to the patella, at the bottom edge of the patella, you're going to come down 3 soon, and over 1 soon, lateral to the tibial bone, you're going to be on stomach 36. This point is called walk another 3 miles. It's great for fatigue. Japanese soldiers in World War II would tie a little piece of cork there so that they could keep marching. Now if you come a little above that, a little proximal to it, find the head of the fibula, which is a big brown ball. On most people you can find it really easy. If you come a little distal to it and a little anterior to it, where those two bones come together, the tibia and the fibula, right below that where you just feel tissue and you're not on bone anymore, that's gallbladder 34. Great point for knee problems. If you go from the knee to the ankle and divide the foreleg in half, the crural region, one seen over from the tibia, that's stomach 40. This one is a good point for phlegm. So if you have the flu, you're clogging up a lot, this is a good point to use. On the top of the foot, between the first metatarsal and the second metatarsal, in that little V, very similar to large intestine 4 on the hand, is another great point. It's called the great surge. It helps get energy back up the leg. And that's liver 3. That's liver 3. The bottom of the foot, where the kidney meridian begins, is kidney 1. It's an energy point. It's called the gate of vitality. You can never have too much kidney. Up from the midpoint of the medial malleolus, 3 soon up, just right behind the tibia, is spleen 6. This is another point you do not want to work on pregnant women, because what it does is it helps muscles relax, and you don't want the uterus to relax. Spleen 6 right there. Now on the lateral side of the ankle, on the Achilles tendon, halfway between the tendon and the lateral malleolus, is bladder 60. It's a great point also for leg pain, calf muscle cramping. And then behind the knee, in the crook of the knee, directly behind the knee, is bladder 40. Some books say 54. Now this particular point, you're going to want to have the person prone, bend the knee up to 90, and then access that point. You want the leg bent so that all the muscles are relaxed and you can go in and work that point. Okay, well, even when you're doing a Swedish, you have to remember the joints are a very important part of what you're trying to help alleviate problems with. So if you work on the muscles and you don't do anything to help the joints, you're really not doing the complete work that you need to do. Joints don't have blood supply. We have to move them, compress them, pull them apart in order for them to get the nutrients they need and to get the waste material taken away. So we need to kind of help them out when we do our massage. The one area that you need to be really careful of is the neck. So if you're going to be stretching and ranging the neck, you have to make sure that you're not going to injure your patient or your client. So you need to find out if they do have neck problems and act accordingly. If they have any kind of fusions, any kind of herniations, you're not going to want to be doing any compressing, what we call approximation, or any kind of twisting. But stretching it, distracting it, that's a really nice thing, because that takes the pressure off and that really helps. But we have a nice neck here, so what we're going to do is we're going to pick them up. Notice I used my thenar eminence to lift the head up. And we're just going to bring our hands so that we're holding his head like this. We don't want our hand directly under his occiput, because then we're going to have to pick his head up and put it back down. The least amount of movement that's jerky you do, the better your massage is going to feel. So if I can not pick his head up and put it back down, but maybe once or twice, that's a much better way to do it. So I'm going to make sure I'm holding him like this, so if I do need to take my hands off, I can, without doing that. So it's you kind of think about which way you want to do it, whichever direction you want to take the neck in. But what we usually do is where one movement flows into the next. So what we can do is start with side bending. That's where you bring the ear to the shoulder. You get in a wide stance horse position, and then you can just rock the body over, bring it as far as is comfortable for the client, and you can rock back to the other side. Now, we could add a little bit of a stretch to that by depressing the shoulder at the same time. So I'm going to bring him over, take this hand off. Never take your hand across their face. It's not polite to hit them in the nose. So you're going to make sure you bring it over their head and cup their shoulder into the palm of your hand. This hand that's under his ear, I'm putting fingers at the insertion of his SCM. So right at that mastoid process, I'm holding that muscle. So that when I hold here and I hold here, I'm getting a really nice myofascial stretch. So all I have to do is push down on the shoulder. And back up, don't go over the face. Bring him to the other side. Position your fingers on the SCM. Bring your hand around and stretch. To rotate the neck, if you bring the head over onto your hand, you can kind of rock it a little bit. Bring it over to the other side and rock it a little bit. To flex, you're going to come straight up. If you think they have a problem with that, maybe the neck is short, there's a little tightness there, you can do it off to one side and then do it off to another. Now you can also do a stretch that works with both scapulas at once, and it really gives a nice stretch to the back of the head. So we're going to take the head up off the table, slip one arm under, put their head in the crook of your elbow, come underneath, position your hand on the other side, and then you're just going to stand up. Take the bottom arm out first, secure the head, put the head back down. Now there's a little advanced work you can do if you want to do extension of the neck. And you're going to do that segmentally, which means you're only going to go between each vertebrae, and there should be 4 spaces that you're going to work on. When you get to the top, you're going to pull on the occiput and give the whole neck a nice stretch. You need to position yourself correctly so that you don't hurt yourself. You're going to put your arm on the table, and it's going to act like a lever. You're going to put your elbow in and lift up the head like this. You're going to place their cervical vertebrae right there on the adductor pollicis muscle between the thumb and the index finger. So it's nice and comfortable, that's nice and soft. You're going to start right above C7 and walk up between each vertebrae. When you position your hand under their neck, you're going to lift up on the neck and you're going to let the head fall back down to the table. And what you want to look for is the nose pointing up at the ceiling. You can do it sitting up or standing, whichever way you feel more comfortable. And it doesn't matter which hand you use. But you're going to position your hand at the base of his neck. Lift up, let your head fall back. And look to see that their nose is pointing up to the ceiling. Be careful not to start grabbing the neck. You want to leave the thumb away from the neck. Pick them up, drop your hand down, move back, lift the neck, let your head fall back. Pick them up, come back, lift the neck, let your head fall. And then on the last one, we're right at the base of the occiput. We're just going to hold and we're going to stretch. So when we stretch the shoulder in this position, I don't need to do this draping technique for a man because you just pull the drape down. But if it was a lady on the table, I'm going to make sure that I drape the arm appropriately and have them feel secure in the work. I want to be able to move the arm without the drape moving, so I'm going to secure it against their body. You're going to put the dorsum of your hand on their deltoid, not their torso, and anchor it, because this is what you're trying to keep from moving, is the top of the sheet. An accordion fold is a fold where you bring the material up into your palm. So you're going to swoop down and uncover the arm, Look for the edge of the sheet because you're going to need to reach under and grab that, so you need to know where it's at. Okay? Medial proximal side to the elbow, you're going to pick the arm up by digging into the vinyl, rolling them into your palm a little bit, and bringing them out to 90. Now this hand, I'm just going to push the fabric down to the table. I don't need to tuck it, I don't need to move it, just need to make sure it stays right there. Turn your body into a horse stance before you let go of anything. Make sure you know where the edge is. Lift the arm, reach under, pull it up, and bring it up behind the scapula. Then you can let the arm go back down. How you're going to test it, pick the arm up, bring it over their head, and it should be at the armpit. You can always adjust it from the top. You never have to touch their torso. So if I were going to flex the shoulder, I always support both limbs, bring them up, and always have the arm positioned where you can now work on it. That means their forearm and hand is away from your body. So you would never hold them like this. You're always going to support them in this position. I could do a nice stretch and flexion from here. You could add a little bit to it just by pressing on the arm and bring it back in extension. I can also bring the arm out in abduction, and all you do is twist the arm over and bring it onto your forearm. To bring it back, you just make a little circle and bring it back. If I wanted to protract the scapula, put the arm in a flexion at 90, I could do that. Movement on the shoulder. Now if I want to do a little more work to stretch the scapula, with my inferior hand, I'm going to walk around the body to bring the arm in horizontal adduction. I'm going to hold the elbow and the wrist and just simply squat to give the shoulder a stretch. Now you notice I'm not up here, I'm down here to give them room to breathe. To walk it back, you do the same thing. Elbow stretching is very simple. You just flex and extend, flex and extend. You could add a little more of a stretch to it, increase the range at the shoulder and the scapula by just locking elbows. Now to recover the arm, you're going to bring this back down as close to the outside of the arm as you can get it. Pick the arm up the same way you did before. Bring it out to 90. Now from here, you're going to bring the drape up and over their shoulder. See, you never have to touch their torso. What I'm doing with my hand that's holding the arm is I've got my thumb in the air. So I make sure I cover that hand with the drape. Grab it here and don't let go because this is what you're trying to protect. And just place the arm back on the table and with your thumb, bring the sheet over the arm. If they want their arm closer to their body, they usually will move it themselves. But if you want to bit it closer, you just push from the outside. So you always are very, very careful that you do not touch the torso of the body. Now for the hip, you're going to stand between the hip and the knee with the edge of the sheet. You're going to accordion fold it up, which means it's coming up into the palm of your hands. And you're going to put it where you want it, which is right at the femoral triangle. Now I'm not going to let go at the hip because that's what I'm trying to protect. I'm going to make sure I get all of this off the leg and the foot so that when I bring it under the leg, it's going to be able to move. Now I can let go here because I need to adjust it. If they are nude or they have disposable underwear on, you really don't have to do anything. He's got underwear on, and I want to make sure I don't get oil on his underwear. So I'm going to roll it up a little bit, and then I'm going to cover it with the sheet. All the way down to the table, and not quite to midline, just a little outside the midline. You're going to hold the bottom sheet, lean back and give it a nice firm tug. With just the edge, you don't want to stuff the whole thing under their small of their back. You're going to tuck this under the small of the back. Push into the table, make sure you go all the way to the spine and come all the way back out. Now, notice where this is. If this is loose or something and you think it might tickle them, you need to make sure that it's secure. Now, just like with the arm, we want to know where the edge is. That's what we're going to use to drape the leg. Legs are heavy. You're going to use the right lifting technique to where you don't hurt your body. So you're going to put their foot on your forearm, just like that. See, I'm not really even using my hand. I'm using my whole body. The trick to massage is keeping your elbows at your side. So when I'm like this, it's me doing it, not my shoulder. Just high enough to be able to reach under, grab the edge, immediately push it down to the table and up against their thigh. Now that the back of the leg is covered, I can walk. I can bring the leg up off the table and I don't have to worry about exposing him. There's a couple of ways you can secure this. I usually just put this edge under the small of the back, but I could also tuck it into the clothing around the edge like I did the top, just so that when I'm done, I don't see anything, they're not exposed in any way, and I can move the leg up and down off the table. So now if I wanted to do ranging for his hip, I can. So this is flexing, so if you just bring the leg up and down, flex the hip, always bring it to the point where you feel resistance. You want to stretch them out, but you don't want to hurt them. So it's better to do it 2 or 3 times and go a little bit further each time than one time, because they're going to tighten up and resist you if you go too far. You can also do it straight-legged. You're going to have to keep your hand on the kneecap, change your position to be more in an archer, and only to their comfort level. If you don't have a lot of time, you can do something that's called circumduction. You just make a big circle with the leg, just a big circle. If I wanted to rotate the hip, I can just turn it from here, rotate it in and out. If you wanted to adduct it, you can simply bring it over, just to the point that the hip starts to come up, because you're really not stretching anything if you keep going. And then to adduct it, whenever you bring the leg away from the body, you need to be sure you know where the drape is. That drape is your responsibility. That's your job to make sure they're covered at all times. So I'm going to make sure it comes with the leg. I grab it before I let the leg fall out to the side. And that is horizontal abduction. Now a little better way to get the hip muscles, bring the opposite contralateral leg closer to you, put their foot on the outside of their knee, if they're comfortable doing it. Sometimes they can't put it all the way down that way. And we're going to come up, hold the hip with the heel of our palm. We never point fingers towards the midline. And we're just going to push that leg across his body and get a nice stretch into all of those glute muscles. Is that okay? Just to their comfort level. And then the opposite way, we're going to put the foot on the inside of the knee, grab the drape, let the leg fall out to the side. You're going to hold the opposite hip and you're going to stretch. To re-drape, bring the leg down as close to the table as possible, pull the top side out, lift the leg just far enough to get it out from under, and put the leg down. Legs are heavy, put them down as soon as you can. Then you're going to come up here and you're going to pull the drape out and gently pull it out from under the back. Step back and pull down towards the floor. Don't ever do this little swoop motion, because then you just exposed them and gave them a nice cold draft. The feet are easy to range. You can put your thumbs on that kidney 1 solar plexus and just simply push up, which is dorsiflexion, and pull down, which is plantar flexion. You can turn it in and turn it out for inversion and eversion. toes flex and extend, so if I want to just grab them all and make fists with my toes, I can do that to flex them. I can support the foot and push up to extend them. The hip, you can stretch out the hip and the whole torso simply by holding the legs and squatting and pushing up a little bit and squatting. With the hand is easy. Just remember you need to support what you're working on. So if I wanted to stretch the hand out at the wrist, I can push it down to flex it, and I can push it back to extend it. I can interlace my fingers and deviate radial and ulnar. And I can also extend the fingers by holding at the MCP and bringing those fingers back, moving up, bringing them back, moving up, bringing them back. The thumb, you just have to do it by itself. So you can move it all around, flex it, extend it, abduct, and bring them back together. Okay. Side lying massage is great for anyone who has any kind of problems with their back, breathing problems, pregnant ladies, anyone like that. And if you're doing any kind of therapy, you want to really help someone's shoulders or hips, this is the position you should work on them in. The guidelines you want to look for is to make sure the spine is in a line, so you support the head but not too high to keep it level with the spine. You want the hip and the shoulder to also be level with the spine, so you're going to have to put a support under the top leg. And if they have their arm forward from their body, it's also going to have to be supported. Now if they just lay their arm along their side, they don't need that support. But if they're going to lay like this for 20 minutes or so for the massage on either side, you really need to bring that shoulder up. Now what we've done is also elevated the torso. So underneath the person's body, we've put a couple of small pillows, little wedge-shaped pillows, and they go up to the armpit, not completely up. We've left a little space. So when they turn on their side, there's a gap between the wedge pillows and the head pillow, leaving room for the shoulder, so the arm is not being crushed the whole time that they're lying on their side. You need to have them come back towards you. So if they're lying on their right, they're going to scoot back closer to you on that side of the table to allow them to have room to throw their leg forward. The bottom leg is going to be straight and brought back level with the hip. The top leg is going to be bent and lying on top of a pillow or a cushion or a bolster, whatever you have that's high enough to make that individual person's hip level. We usually start on the back. We usually follow the same energy pattern as we would for any other massage. We're going to do what we call clear the pathways. We want to warm up the tissue from the heart, work our way out to allow the blood to come back. For a man, it's not so important. For a woman, it is important. So what we've done on the front with that sheet is we have tucked it under their shoulder that's against the table. Just think toga. So you want to pull it up against the neck. You don't want the support under the top drape. That top drape is going to be up against their body. And with their arm there and with their toga, it's pretty much not going to fall down. You're going to bring it down. And if they have their underwear on, you're going to tuck it because you want to make sure you don't get oil on their clothing. So when you're working on the back, you've got the arm forward, the sheet is up against the chest, it's tucked into the hip, and you have access to the back and the shoulder. It's not a good idea to try to work both sides of the spine when they're in side lying because you have a tendency to pinch the skin up against the table. You might be able to work on the erector spinae on both sides, but please don't try to access both sides in one position. You're going to turn them over. You don't really need to do that. If they have a lot of back strain, like if it's a pregnant woman, you're going to want to do a lot of stretching down towards the hip to relieve that strain in the back. Some people work on the abdomen I don't. That's kind of a preference for yourself. I usually don't do it, especially if they're pregnant, but you can always do that if you'd like. For a man, it really doesn't matter. You just pull the sheet down. If it's a woman, you can even work on the outside of the sheet to protect their privacy, or reach under the drape to work on them. You can do this in sitting or do partial sitting. It's kind of up to you. You always have more force if you're standing, but it is a nice way to get a little break and sit down most of the work. You're still going to use the same posture and the same techniques with your archer stance and your horse stance. You're still going to reinforce your hand and not overuse your thumb. But the great thing about this position is all of the muscles are totally relaxed and they're falling away from the bone. Gravity has been neutralized. You can work the neck muscles, go really, really deep because they're all very, very soft. It's kind of awkward to do the face and the scalp. What you can do is save 5 minutes at the end of the massage, have them lie on their back in a semi-reclining position, and work on that then. The arm you can move into many, many different positions. If you want to work on the arm, you just simply take this away, and then you're going to put it back. You can work from the front position, very similar to what you were doing before when you're working in Swedish. Just always make sure that arm is away from your body. So you're going to hold them like this. Then you got two hands and you can manipulate the shoulder, work on the scapula, do some really nice stretching. You can bring the arm over the head, position them here. And normally when you're doing someone flat on the table, you really don't have access to these muscles here. And in this position you do. You can do some really nice stretching and nice work on the arm from here. If you want to bring the arm back and lay it along the edge of the body, you can. Position it and hold it, and you could do some really nice deep work along the forearm and the top of the shoulder. You can depress the shoulder, work this area. Makes it much easier than if they're flat on the table. You can also work it from this position. On a man, of course, you can do the chest. If it's a woman, you can still do above the décolleté line, and they don't feel as invaded as if you were trying to do this when they're flat on the table. It's much more secure feeling for them. Now the hand, you can do a little bit on the hand, on the top hand, but if you look at the bottom hand, it's perfect position to work on it. You can do with your thumbs, work the palm, everything that you would do if they were in prone or supine. Turn it over, anything that you want to do like that. So I normally would work the hand with this one and not that one. When you're ready to move to the lower body, you can cover the back with the drape. It's kind of up to you which leg you do first. I don't think it really matters. You can work the hip from back here. You don't need to expose it. You can work through the sheet. Be sure you got permission from your client to work in this area before you work in this area. And you'll notice how much easier it is to work and get into the muscles. And the part that you need to be careful about, where the sciatic nerve is lower. It's not up where you're working. So it's a little safer position to be in for that. If you want to work on the lower leg first, since you're on this side of the body, draping is very simple inside line. You're still going to not go into the femoral triangle, and bring the back leg straight a little bit. So you still have to avoid the femoral triangle, but you just point your fingers away and just tuck it. If they have their own underwear on, you don't want to get oil on it, so you're going to bring it just a little bit into the clothing. And what I like to do to secure it a little bit better is I take the dorsum of my hand and I just rock it under the lower hip just to make sure it stays. And then you can work on the leg. Now the one place where people are prone to get varicosities is the inner thigh. So if you feel ropiness, you feel a little bit of heat, you see bulging veins, be very, very careful. The only thing you can really do is some light effleurage. Then you can work the calf. You can work the plantar surface of the foot really easy. You can even bring it back a little bit and work it from here. And then cover it back. Now for some people they think this is a problem to drape, but it really isn't. Because what you're going to do is you're going to make a U with the drape. So I'm going to hold the middle of it and keep these two together so it looks like a U. And I'm just going to bring that up the leg till I get to the hip. Now he's got the worst kind of clothing on that you can have on because it's really difficult to work with boxers, but we can manage. And we're just going to tuck it here and tuck it there. Now the part of the leg that people feel insecure about, the inner thigh, is against the table. So I'm not even going to go there. I did the work on that leg and they didn't feel invaded because everything was covered at the hip. So now I can just work on the thigh, top and bottom at the same time. And I can go back into the hip from here, and I don't have to get under the sheet to do it. And I can work this side of the foreleg, and I can work the top of the foot. Now if I want to do ranging and sideline, I'm not going to leave the leg exposed. I can do everything I want to do with the leg covered, and then they don't feel that anything is going to happen that's wrong. So in this position, I can leave the sheet on, I can pick the leg up, bring it up to flex and extend the hip. I can even do a little bit of circumdection with the hip. You could do a straight leg stretch as well, and you're probably going to see you get more of a stretch in this position than you would if you were picking it up off the table and straight up into the air. And put it back. Now I'm going to show you a couple of specialty stretches that are really great. They get the whole body. Now you notice the top leg is forward, so what we're going to do is bring the arm back. So just let your arm fall back, okay? And we're going to twist them. So I'm going to put my forearm, not my elbow, into the glute medius muscle. I'm at the top of the hip. I'm going to put my forearm against his deltoid below the shoulder complex. So I'm going to push the whole thing up. And it's a myofascial release because I'm anchoring both ends. You can do it without a breath, or you can have them breathe. Take a nice deep breath in for me. And then I'm just going to lean over and spread my arms out. Does that feel okay? Hold it 7 to 10 seconds and release. Now I can bring that top leg back and bring the shoulder forward. So just bring this leg back. Yep, just behind your bottom leg. There you go. You can take it off the leg. I'll do that later for you. We don't really need to do that now. So now we're going to twist him just a little bit. You know, not hanging way off. There you go. Just back. Now we're going to do a stretch in the different direction. We're still going to move the whole complex up so we're below the scapula. We're in the same position on the hip, so I'm at the top on the gluteus medius, and we're going to have him breathe again for us. And now we're going to stretch him this way. And you make sure you help them with their leg, that you help make sure that it's still on the top of the table. Then when you turn them over, you would do the same thing on the other side. Okay, to turn the person in sideline from one side to the other, first you're going to remove the pillow, the support for the leg. You're going to take the support for the shoulder away. Now they're still on the little wedge pillows that are underneath them, and the sheet usually has gotten kind of tangled up around the person. So what we're going to do, we're going to make sure that they feel secure. We're going to stand here and we're going to ask them to move over and then turn onto their back. So move towards the middle of the table and then turn onto your back for me. Yeah. Yep. And you can kind of pull that little pillow with you as you turn. Good. Okay. Now go over to the other side of the table. Move over there just a little bit. Always keep your hands so they feel secure. And then before we have them turn on their side, we're going to make sure the sheet is straight. Because sometimes the bottom sheet gets twisted and the sheet on top does as well. So we want to make sure we have all the sheet that we need. And they're closer to you. Now you can turn and face away from me, please. And they're going to need to put that wedge pillow back under their torso. What you can do if it's a woman is you can pull the whole thing up, and then they can put the pillow where they need to put it. For a guy, you don't have to do that. And they've left the space under the body just like they did before. We're going to ask them to put the sheet up against their neck like a toga. Tuck it under their chin. Okay, is that comfortable? Okay. The bottom leg is straight. The top leg is bent. We're going to put the bolster support back under the leg. Put your knee up for me. And put it where they're comfortable. Some people like it high, some people like it low. And give them back their little cushy to hold their arms. And you're ready to work on this side. So you can bring the sheet down along the torso and tuck in the underwear. And now you're ready to work on the back in this position.